Assalamu alaikum, this is Mirza Ahmad Khan, and the drug I'm going to present here is Emtricitabine, abbreviated as FTC because of its chemical name, which is fluorooxathiolenyl cytosine. It is basically a cytidine analog classified as nucleoside reverse transcriptase inhibitor, or can be called as NRTI in short. It categorizes as antiretroviral drug. Rational use: it is FDA approved for treating human immunodeficiency virus in combination with other antiretroviral agents. It also has activity against hepatitis B virus. Side effects are headache, diarrhea, nausea, asthenia. Asthenia is an abnormal physical weakness, and rash are common. Hyperpigmentation of sores and palms may be observed in some patients. Emtricitabine is available in two dosage forms, capsule and the oral solution. When patient feels difficulty in swallowing a capsule, especially the elderly and young children, then oral solution is administered. The dose for capsule is 200 mg per oral once daily due to its longer half-life. Oral solution is available in the strength of 10 mg per ml, and the dose for oral solution is 240 mg, that is 24 ml per oral once daily. Dose adjustment is required in renal dysfunction, as 86% emtricitabine is eliminated unchanged in urine. If the person has a creatinine clearance 30 to 49 ml per minute, then the time interval between two doses is increased, that is 200 mg capsule is given after every 48 hours. And the dose for oral solution is reduced to half, that is 120 mg per day. If the creatinine clearance is 15 to 29 ml per minute, the dose is 200 mg after every 72 hours, and the oral solution dose is further reduced to 80 mg per day. If the creatinine clearance drops below 15 ml per minute, then the dose is 200 mg after every 96 hours, and the oral solution dose is reduced to 60 mg per day. No such dose adjustment is required in hepatic impairment, as the impact of liver impairment is limited as it is not metabolized by liver enzymes. For pediatric patients aged 3 months to 17 years, oral solution is given in the dose of 6 mg per kg up to a maximum of 240 mg per day. Capsule can be given if the children weighing more than 33 kg and can swallow intact capsule, then 200 mg capsule can be given once daily. For geriatric patients, it can be given but with cautions, checking the frequency of decreased renal function or other diseases. In pregnant women, oral solution is contraindicated because of the presence of propylene glycol in it, which is harmful for a pregnant lady. Capsule can be given but with cautions. Drug interaction. No such drug interaction is found, as they are not extensively metabolized by liver enzymes such as P450 isoforms. Emtricitabine is a fluoroderivative of lamivudine, so they both should not be used together because they have similar resistance profiles and do not confer any additional virologic benefit. Drug toxicity. Sometimes it can cause emtricitabine is not a toxic drug, but sometimes it can cause lactic acidosis with or without hepatic steatosis and hepatomegaly. Hepatic steatosis is a condition in which there is accumulation of fat in the liver cells, and hepatomegaly is the enlargement of liver. Toxicity antidote. No known antidote to emtricitabine. If overdose occurs, symptomatic treatment is given. Hemodialysis is used to remove about 30% emtricitabine dose over a 3-hour phylaxis period. Alternative choices. Lamivudine can replace the emtricitabine because it can also be used in co-infection of HIV and HPV. Emtricitabine can also be replaced by tenofovir because it also has a use in co-infection of HIV and HPV, and it is also safer on kidney as compared to emtricitabine. Emtricitabine can also be replaced by stavudine because it is safe and effective for child and infants. Alternative brands in terms of pharmacoeconomics. Emtricitabine is available in combination in Pakistan. The brand which is available in Pakistan is Truvada, which is a combination of two active ingredients, that is emtricitabine and tenofovir, and the price of Truvada is 10,200, while Descovy and Atripla are not found in Pakistan. Descovy is also the combination of two active ingredients, that is the emtricitabine and tenofovir, while Atripla is a combination of three active ingredients, that is the emtricitabine, tenofovir, and efavirenz. Irrational uses. Pre-exposure prophylaxis without clinical guidance can cause acquired HIV drug resistance. Suboptimal dosing and irregular use can also cause resistance. Use of FTC with unspecified drug can increase the chances of adverse events. Now the case study. 38-year-old single white woman named Aria visited the clinic with a new diagnosis of HIV infection during routine testing 2 weeks ago. On questioning, she tells the complaints of fever, 39.8, 15-pound unexplained weight loss over the past 3 months, persistent fatigue, and white patches in her mouth experiencing over the last 5 to 6 weeks. Her T cell count is 260 cells per microliter, and HIV RNA is 122,000 copies per ml. She has no known drug allergies, smokes 10 cigarettes per day, and was also a binge drinker. Her CBC, electrolyte, liver, and renal reports are normal. Her weight is 72 kg and height is 5 foot 5 inches. She is highly motivated to control her disease. She is an architect, prefers to take medicine 1 time a day. What antiretroviral regimen should be recommended to area? Subjective data. Chief complaint is HIV infection. History of present illness is Area is a 38-year-old white woman presented with a new diagnosis of HIV infection during her routine testing 2 weeks ago. With symptoms of fever, unexplained weight loss, persistent fatigue, and white patches in her mouth over the last 5 to 6 weeks. Medical history is HIV infection diagnosed 2 weeks ago. Family history is non-contributory. Social history is she is single, works full day as an architect, smokes 10 cigarettes per day, recovering from binge drinking of alcohol. Drug allergy is not known. Objective data. Physical examination shows she is white woman with 72 kg weight and 5 foot 5 inches height. 15-pound unintelligible weight loss over the last 3 months. Vital signs are her blood pressure is normal, which is 127 by 72. Temperature is 39.8, which is elevated. Pulse is 70. Lab test. Her CBC and electrolyte reports are normal. Liver and renal reports are also normal. HIV RNA load is very high, which is 122,000 copies per ml. This viral load indicates the spillover of virus from replication in the plasma. T cell count is very low, which is 260 cells per microliter, which is indicating the compromised immune system. Because otherwise in healthy individual, this T cell count is more than 1200 cells per microliter. For the purpose of diagnosis, ELISA and Western blot tests both are done and both show positive for HIV antibody. Her symptoms are fever, white patches in mouth, weight loss, and persistent fatigue, which shows a sign of thrush infection causing white patches in her mouth. Assessment. Areas infected with human immunodeficiency virus confirmed by ELISA and Western blot test. White patches in her mouth caused by an opportunistic pathogenic yeast, that is Candida albicans, which also supports the diagnosis, as it attacks on immunocompromised individual. Fever, unexpected weight loss, and fatigue are due to HIV infection. Because this could be because your immune system is working hard to combat the infection, or it may be because HIV has affected the metabolism, which causes the loss of appetite, results in fatigue. Plan. Counsel the patient that she could be the source of infection to others. Educate her to avoid transmission. Encourage her for regular follow-up care and repeat T-cell and viral load measurement after every 3 to 4 weeks in order to monitor the effectiveness of treatment and to keep an eye on the disease progression. Teach her to recognize her symptoms carefully. Encourage her to stop smoking and drinking completely. Encourage her to start sound dietary practices, sleep, exercise, and maintain hydration to optimize immune system. Now, according to the guidelines of the US Department of Health and Human Service, they recommend to initiate the therapy when viral load is more than 100,000 copies per ml and T cell count is less than 350 cells per microliter. So, emtricitabine, tenofovir, and efavirenz is given in the combination in the strength of 200 mg, 300 mg, and 600 mg, co-formulated as A-tripla, 1 tablet per oral once daily on empty stomach in order to reduce the side effects, preferably at bedtime. If fever not get better with hydration and rest, take acetaminophen 500 mg per oral after every 4 hours as needed. I have prepared my presentation from these references. Thank you.